What role do genes play in Parkinson's diagnosis? Imagine your genes as a set of instructions that shape many parts of your body, including how your brain functions. In Parkinson's disease, genetics play a role but are part of a bigger picture. Most cases of Parkinson's are considered sporadic, meaning they happen without a clear inherited cause. But research shows that genes can influence the risk of developing the disease. Scientists have identified about 90 genes that may contribute to Parkinson's, with some having a stronger link than others. Two genes that have been studied extensively are LRRK2 and GBA. Variations in these genes are associated with a higher chance of developing Parkinson's, but they do not guarantee it. Genetic testing is not usually part of the routine diagnosis for Parkinson's, especially in cases that develop later in life. However, it can be helpful in specific situations. For example, if someone develops symptoms at a young age or has a family history of Parkinson's, doctors might consider genetic testing. Certain ethnic groups, like Ashkenazi Jewish or North African Berber populations, have a higher prevalence of specific gene variants linked to Parkinson's. Testing can identify mutations in genes such as PRKN, PINK1, PARK7, LRRK2, and GBA. Some forms of Parkinson's are inherited in patterns called autosomal dominant or recessive, meaning the risk can be passed down through families. Risk for Parkinson's is often polygenic, meaning many small genetic variations add up to influence the overall risk. Researchers use tools called polygenic risk scores to estimate an individual's genetic predisposition based on multiple gene variants. While these scores can suggest higher risk or earlier onset, they are still mainly used in research and are not yet standard in clinical practice. Knowing about genetic factors can support diagnosis, especially when symptoms are unclear. It can also help predict how the disease might progress and guide personalized treatment options. For some patients, participating in clinical trials focused on gene-specific therapies might be an option. Additionally, genetic information can be valuable for family members who might also carry risk variants. It's important to remember that genetic testing for Parkinson's requires careful counseling. A positive result does not mean someone will definitely develop the disease, and a negative result does not rule it out. Emotional and ethical considerations are key when deciding whether to undergo testing and how to share results with family. In summary, genes contribute to the risk of Parkinson's disease and can sometimes aid in diagnosis, especially in early onset or familial cases. While genetic testing is becoming more accessible and informative, it is not yet a routine part of diagnosis. It works best when combined with clinical assessment and professional counseling, helping to personalize care and open doors for research participation. Always consult healthcare professionals for personalized advice and support.